Afternoon, everyone. Welcome. Thank you so much for joining us. My name is Angela Papalia. I'm the Assistant Director with the Adelphi New York Statewide Breast Cancer Hotline and Support Program. Welcome to Surviving Cancer, Empowering Yourself with Nutrition and a Healthy Lifestyle. We're thrilled to have you here with us today. This wonderful program is being offered as a collaborative partnership with the Adelphi Breast Cancer Program, Sisters United in Health, Northwell Health, and the Cancer Services Program of New York State. Please note that this program is currently being recorded. If you prefer not to be recorded, feel free at this time to shut off your screen so that way you will not be on camera. You can also refer back to this program at a later time once we offer that to the public after today's program. Okay, we're going to get started, and I'm delighted to introduce our incredible speaker this afternoon, Dr. Heather Zinkin. She is a radiation oncologist at Northwell Health in Huntington. She has a special interest in breast cancer, integrative medicine, patient wellness, and nutrition. Dr. Zinkin is the Chief of Radiation Medicine at Huntington Hospital and frequently lectures in both the hospital and community settings. Please join me in welcoming Dr. Heather Zinkin today. And please note that later on at the end of the program, if there is time, there will be an opportunity to write in the chat for a brief Q&A. Thank you, Dr. Zinkin, and welcome.
Thank you so much. Okay, I'm going to share my screen now. I think, did you unshare your screen?
I did.
Okay, just tell me when you can see it. For some reason, it's not. Okay, 1 second. Tell me, can you see it now?
Yes, you're on.
Perfect.
Okay, sorry. Okay, so welcome everyone. I'm going to get started because I have a lot to say. So today I'm going to be talking about empowering yourself with nutrition and lifestyle changes. And, you know, as thank you for that introduction. Just to clarify, so my primary job is a radiation oncologist, and, you know, I've taken a lot of special interest in personal health, and my philosophy is that, you know, we can offer patients surgery, radiation, chemotherapy, but if you're not doing your part and taking good care of yourself with nutrition and exercise and so forth, then your treatment is really incomplete. And there's so much information out there that I've really taken it upon myself to be educated about this information, because unfortunately, medical school, there's little to no teaching on this topic. So I've taken courses through Cornell, who has an excellent nutrition program, and done an enormous amount of research on the topic. So everything that I recommend and present is really evidence-based approach. And so with that, I'm going to get started. And so, as you know, following treatment of breast cancer, there's a lot of treatment-related toxicities, including weight gain, hot flashes from the medications, chemotherapy effects like neuropathy, joint pains, vaginal dryness, sleeping difficulties, anxiety, and fatigue. So I'd like to try to tackle these issues. And I'm also going to discuss nutrition and lifestyle. So the optimal diet to improve survival and quality of life, the heart-breast connection, and showing you how cardiac health is vitally important and connected to breast health. And we'll discuss some natural remedies for hot flashes that are safe, exercise, stress, anxiety, and better sexual function. So a lot of women ask me, what do I eat? And there's an American Institute for Cancer Research, which has 10 recommendations, the last of which is that cancer survivors should follow the dietary recommendations for cancer prevention. So it's nice that the same diet for survival is the diet that will also prevent additional cancers in the future. And they have a whole list, which I'm not going to read this whole busy slide, but in general, their recommendations are rather straightforward in that you really want to be lean, be active, eat mostly plant foods, less red meat, less alcohol, less salt, and you really should obtain your nutrition from whole foods rather than supplements in general. And the healthy eating plate has changed a lot since I was in elementary school. So instead of the 4 food groups, now it's recommended that at least 50% of your plate should be comprised of fruits and vegetables, whole grains, about a quarter, and then a healthy protein. And this is from the Harvard School of Public Health. And if you look, even the proteins that they recommend are, fish, poultry, I'll stress beans and nuts, limiting red meat and limiting cheese, avoiding cold cuts as well. And I'm really going to get more into this as I continue. And so where's the evidence for this? So this was one of the earlier trials that was done. It was a randomized trial looking at the effect of a plant-based diet on breast cancer events and survival. It's called the Women's Healthy Eating and Living Trial, or the WHEAL study. And this was a multi-site randomized controlled trial conducted over a 5-year period, where they took women with early stage breast cancer, followed them for 6 years. 2/3 of the women were under age 55, and they enrolled over 3,000 women. And half of them were randomized to an intense diet intervention that included 5 vegetables a day, 3 fruits, vegetable juice, 30 grams of fiber, which is more than most people obtain every day, and only 20% of your calories from fat, versus a control group. But even the control group were advised to eat 5 servings of fruits and vegetables a day, which many people don't do on a daily basis. And what they found was that the highest level of vegetable intake was associated with the lowest risk of breast cancer recurrence. And if you look at this graph, actually, that shows survival, they also identified women who were the most active. And you can see that this blue line here is separated from the other 3. And these were the women who not only ate the most fruits and vegetables, but also exercised the most. So the combination of a high fruit and vegetable diet in combination with exercise is absolutely associated with a significant improvement in survival. And then when they kind of did a deeper dive, they found that which vegetables are most important were the cruciferous vegetables. And those are the broccoli, cauliflower, Brussels sprouts, kale, spinach. And I reiterate that a lot, that those are really important to have at least one of them every day. And then they kind of did a subset analysis where they said, well, let's look at the women who have estrogen sensitive tumors and the women who have ERPR negative tumors, or those triple negative tumors. And they actually found that the significance was even more pronounced in the women who were ERPR negative. So, some of these patients are upset. There's no option for anti-estrogen therapy, but it looks like the importance of a high vegetable diet is even more important in women who have ERPR negative tumors. There was a second trial that was done very similar called the WINS trial. And this also looked at women with breast cancer. It was a nutrition interventional study, enrolled over 2,400 women between the ages of 48 and 79. And a similar breakdown where they had an intervention group where women received less than 20% of their calories from fat, so a very low fat diet. They were met with nutritionists, were offered counseling, high fruits and vegetables. And the control group in this arm was just told to eat their normal diet. And again, they found that there was a significant improvement in survival in the women who ate the most fruits and vegetables, but this effect was even most pronounced in the ERPR negative subgroup, where they had over 50% reduction in mortality. And that's frankly a bigger benefit than you'll even see with some chemotherapy trials. So it was pretty impressive. So I, in general, do advocate for my patients to eat a plant-based diet, less animal foods, less meat, less dairy, less eggs. And I want to present the reason and some of the data. So why is meat bad? So there's several studies. I selected some of the more impressive ones. And this was a study that was done in England, the UK Women's Cohort study, where they enrolled over 35,000 women and followed them for 8 years. About 1,800 of the women developed breast cancer. And then they went back and did a dietary analysis and found that basically all meat intake was associated with an increased risk of cancer. And this was not only red meat, which gets a bad rap, but also processed meat and even chicken. The risk was certainly lower, but meat is meat. So I always say anything from an animal, you should try to minimize. You don't have to avoid completely, but it certainly is healthier to get your food from plant-based sources. And you can see on this graph that with meat consumption, as the amount increased, the risk of cancer just continued to climb. So the less meat you eat, the better off you are, lower risk of breast cancer. And I just wanted to show the same is true for endometrial cancer. And I can show another slide about prostate cancer. And it seems that these hormone sensitive cancers like breast, GYN cancers, prostate cancer are the most sensitive to diet actually. This was another study that was done in the Adventist, and for religious reasons, they eat very little meat. So they're really a good population to study for cancer risk, and they have been found to have one of the lowest cancer risks. So this study was done with the Adventist. There's several studies looking at this population, and this was one which enrolled 69,000 women for over 5 years. And they looked at women who were vegans, who were lacto-vegetarians, so they only had milk, pesco-vegetarians, so they only had fish, and then what they called sometimes vegetarians. They ate meat occasionally. And what they found was only the vegans who had no meat, no milk or eggs had a 44% lower risk of breast and gynecologic cancers. So, women say, well, what about the ketogenic diet? That's advocated by some people. And the theory is that if you're lacking carbohydrates for a fuel source, the body or the liver can use fat to produce ketones. And the idea is that since, as we know, cancer feeds on sugar, why not cut out sugar or carbohydrates and really follow a diet that's high in protein and fat? And the problem is that all human cells feed on sugar. The good cells need sugar too. And cancer can actually feed on ketones. And so in experimental models, what they found is that if you actually drip ketones onto breast cancer cells in a dish, it can actually activate new genes and create more aggressive disease. And this is associated with a decreased survival. So ketones are really not favorable for breast cancer. In fact, researchers are actually now investigating ketone blocking drugs, to treat breast cancer. And we know that high animal fat diets are also associated with increased mortality in breast cancer. So with the exception of patients with primary brain tumors where there's a potential that the ketogenic diet may be helpful, in general, I would say 99% of cancers, a ketogenic diet is generally not recommended at this time. So a lot of patients say, well, if you're telling me not to eat meat or animals, where do I get my protein? And so my argument is plant-based protein. And I wanted to just give you an example of 2 meals. And of course, I chose a healthy salad versus bacon, which is sort of an unfair comparison. So we'll change it to salmon. So, okay, if you're having a meal of 500 calories, I would argue that both of these meals have the exact same amount of protein. And you can get plenty of protein from vegetables, actually. And the advantage of having this meal is that you also get a ton of micronutrients, a lot more calcium, no saturated fat or cholesterol. And the most important factor to me is look at the fiber content, 20 grams versus 0. And as I will explain, no one is lacking protein, or very few people, I would say, are lacking protein, but almost everyone is very low in fiber. And that's really the nutrient that we should be focused on, is increasing fiber in the diet. And you can get a lot of protein and fiber from beans, nuts, seeds, vegetables, kale. And so I'm going to talk more about that. So, why is protein really not great? So the major source of fat in the diet is protein. And that's where we get most of our fat is protein. There's very little fat in vegetables and fruits. And there's a direct relationship between, as fat in the diet increases, the risk of cancer increases. And these are just some graphs showing that, again, as I said, as fiber increases, the risk of cancer increases, and fat consumption increases directly with protein consumption. And the problem is that the way that the body responds to fat and protein is by releasing bile, and bile is a known carcinogen. And the basic amino acids in animal protein are actually quite different than the amino acids found in plant protein. And those that are found in the animal protein and fat seem to promote insulin-like growth factor, which in turn promotes cancer growth. And this is quite different than the amino acids found in plant proteins. And this is actually an area of active investigation right now. And so just to further that point, this was a really nice study that was done looking at animal fat and pancreatic cancer. And it was a prospective study looking at 500,000 patients and looking who developed pancreatic cancer. And out of the 1,200 patients who developed pancreatic cancer, they looked at their animal fat intake. And if on this graph, you can see that the hazard ratio is the risk of cancer. So anything above this line here is associated with an increased risk of cancer. So when they looked at total meat intake, red meat intake, dairy intake, all animal foods, you can see a direct increased risk of pancreatic cancer with those animal products and fat. However, when they looked at plant protein, there is no increased risk of pancreatic cancer, and it was the only diet that did not show an increased risk of pancreatic cancer. So I want to talk a little bit about dairy, and I'm sorry for those of you who like your cheese and yogurt and ice cream, but dairy is not good for breast cancer. And there's a few reasons why. And I'm not going to bore you with these biochemical pathways, but the idea is that dairy has two main proteins in it. One is casein and the other is whey. And a lot of data shows that they're probable carcinogens because of this biochemical pathway that they follow. So when you ingest dairy, they are metabolized in the liver, they produce insulin, they go through this pathway, and they ultimately stimulate something called mTOR. mTOR is a known carcinogen. And in fact, there are breast cancer chemotherapy drugs that are designed specifically to block mTOR. One of them is called everolimus or Afinitor. And so we know that mTOR stimulates cancer cell growth and proliferation. In fact, to further that point, there are some drugs like metformin, which are used for diabetes, which unintentionally actually block mTOR. They inhibit this pathway in mTOR. And there are studies showing that patients who are taking metformin have a lower risk of breast cancer, interestingly. So this, again, is an area of active research. And this is one of the reasons that dairy is generally not recommended. There was a study actually about dairy that was just published about a year ago at looking in Loma Linda University, where they looked at 53,000 cancer-free women who they followed for breast cancer, and a little over 1,000 of them did develop breast cancer. So they went back and they looked at their dairy intake, their soy intake, their calorie intake, and they found that the higher total calories and the more milk that they drank, cow milk I should specify, was associated with increased risk of breast cancer, independent of their soy intake. So they divvied up women by looking at women who drank about a quarter to a third a cup of milk a day, 1 cup, 2 to 3 cups. And you can see as the cow milk intake increased, so did the risk of breast cancer. And what's interesting is they found a significant reduction in breast cancer risk in the women who substituted soy milk for cow milk. And I'm going to talk about soy because soy, unfortunately, is very misunderstood. So I want to clarify some of the information about soy. But soy, I would argue, is an excellent substitute for cow milk. And this risk of breast cancer was found in women who had both full fat and non-fat milk. And the hypothesis is that 75% of cows are kept pregnant most of the time, and therefore they have very high estrogen levels. And so it doesn't matter if the milk is full fat, non-fat, but there's a lot of estrogen in milk. So that combined with the carcinogenic effects of their protein stimulating mTOR can result in an increased risk of breast cancer or breast cancer recurrence. And so what I generally recommend is really trying to minimize, you don't have to eliminate, but minimize dairy intake. And fortunately, there are so many good dairy substitutes that have become trendy now. It's not difficult to find substitutes such as I said, soy milk, oat milk, coconut milk, almond milk. And I will discuss that more in a moment. And so, the next question I get is, well, if you're telling me not to drink milk, where do I get my calcium? And that's another myth, is that you need dairy for calcium. It's just not the case. There is an enormous amount of calcium and iron as well in plant-based foods, particularly beans and nuts and seeds and tofu. And I just list some sources here, and you can absolutely get plenty of calcium and iron from plant-based sources. And as I alluded to earlier, fiber is kind of the missing nutrient, and almost everyone is really fiber deficient. And the benefit of fiber is that it lowers the risk of not only breast cancer, but multiple cancers, colon, ovary, uterus, just to name a few. It lowers the risk of developing diabetes. It decreases blood pressure, cholesterol, improves heart disease, lowers the risk of stroke. It improves the gut microbiome, which is kind of the healthy bacteria in the gut that I'm going to mention. And it's good for constipation. There's multiple studies showing that it's really important to increase fiber in the diet. And just to give you an idea of a high-fat diet versus a high-fiber diet, a high-fat diet produces an unhealthy gut microbiome. You get these secondary bile acids, which is said is a carcinogen, ultimately causing colon inflammation and potential tumorigenesis, whereas a high-fiber diet really produces a healthy gut microbiome, healthier amino acids, these short-chain amino acids, which in fact will actually decrease inflammation and decrease the risk of cancer. And why is the gut microbiome important? So there's a lot of research on this new substance that's been discovered called TMAO, or trimethylamine N-oxide. And it's been shown in several studies that high levels of TMAO can be associated with increased risk of cardiac disease. The good news is that when you eat fiber, your gut will select for these fiber-eating bacteria and decrease the TMAO in your gut. So there's different types of gut bacteria, and to kind of simplify it, when you eat animal foods, it seems to increase the type called Bacteroides, and these are the type of bacteria that you don't want that produce TMAO. However, if you eat mostly plant-based foods, you have a prevalence of the Prevotella type, and this is actually the healthy bacteria that you want, which decrease TMAO in the gut. And furthermore, it's been shown when you have these favorable bacteria in the gut, you actually can respond better to even drug therapy. So there's a lot of new studies that have been published showing that immunotherapy is much more effective in patients who have a healthy gut bacteria biome. So there's a lot of clinical trials going on where they're actually giving patients receiving immunotherapy, and these are drugs like Keytruda that you may be familiar with, and they're feeding women a high fiber diet with beans and nuts and seeds to determine whether there's an improved response to immunotherapy. And what are the best sources of fiber? So I say green leafy vegetables, fruit, beans, lentils, nuts, seeds, whole grains. And you want to aim for at least 25 grams of fiber a day, but there's no upper limit. And so if you look at this graph, you'll see that as daily fiber in the diet increases, actually the risk of cancer goes down and actually continues to decline. And, vegetarians actually only average about 20 grams a day, but you can see as the more fiber, vegans who average about 47 grams of fiber a day, look how low their risk of breast cancer is. And they do, in fact, have the lower risk of all cancers. And so it's important to really increase fiber, and you want to just do it slowly. You don't want to all of a sudden have an enormous amount if you haven't been, just because you need your body to acclimate slowly so that you don't develop too many problems with gas. And so in summary, I would say it's important to eat a low-fat, plant-based, fiber-rich diet, but of course not all vegetables are created equal. So again, I'll stress the cruciferous are best. I try to have at least one of these every day, which are listed below. And even the American Cancer Society has caught on, and in their recommendations, just to point out, they recommend a diet that's high in vegetables, fruits, whole grains, and legumes, which are beans. And I want to stress that I'm not saying you have to switch your diet 180 and become a vegan. It's not all or none, like being pregnant. But even if you can be 80%, 90% plant-based,
tonight, you mean, for the kids?
you're better off much better off. So I would say just try to eat mostly plant-based, but it doesn't have to be 100%. So I want to talk about a few specific foods, and I mentioned the cruciferous vegetables. And the reason these are really so important is that they contain something called glucosinolates. And these break down into compounds of sulforaphane and indole-3 carbinol, which are potent anti-cancer chemicals. And these also activate inside the immune system and intestines to enhance immune function. And there are studies both in the lab and in people that have shown that sulforaphane suppresses the growth of many different cancers. And just a cooking tip I like to mention, because a lot of people don't realize that in raw broccoli, you have a sulforaphane precursor called glucoraphanin. And it needs to mix with an enzyme called myrasinase in order to produce sulforaphane. And when you chew broccoli, it produces this enzyme. However, unfortunately, when you cook broccoli, it destroys this enzyme. And so you need to add back the enzyme in order to produce the sulforaphane. So after cooking broccoli, I always recommend sprinkling mustard powder on top of the broccoli, which really does not change the flavor because mustard also contains this enzyme, myrasinase. So I always keep mustard powder in my spice rack, and I sprinkle it on the broccoli after cooking, and then you'll regenerate the sulforaphane, and it becomes much healthier. Okay, so just a word about coffee. A lot of patients come in telling me they stopped drinking coffee, and I ask them why. And, you know, coffee gets a bad rap, I think, unfairly, because I will argue that if you drink it correctly, coffee is actually good for you. And the problem was a lot of the studies initially looking at coffee also looked at women that were smokers or patients that were smokers, because often you have coffee in one hand and a cigarette in the other. But if you actually control for that fact and look at coffee intake in non-smokers, there's ample data showing that coffee intake is actually good for you. It actually cleans out the liver. And there was this study that was, you know, hot off the press, just published in March, which was the Nurses Health Study that showed that women who had 2 or more cups of coffee a day had a significantly lower risk, actually, of developing breast cancer. So I would argue that coffee is good as long as you drink it correctly. So what do I mean by that? So coffee has good properties in that it contains chlorogenic acid, which is a potent antioxidant, which is good for you. And it also, as I said, cleanses the liver. The negatives are that the beans are really heavily sprayed with pesticides, so it is important to have organic coffee. It can contain cholesterol if you don't use a filter, so it's better to have drip coffee rather than French press or the pods. And dark roast can contain polycyclic hydrocarbons, which can be theoretically carcinogenic. So the best type of coffee that I recommend is having it organic, so that you don't have to worry about the pesticides, a medium roast using a filter for the cholesterol fact. And then interestingly, cow milk, not only is it bad for breast cancer, but it seems that when you add cow milk to coffee, it actually decreases its antioxidants. So it's important to add a non-dairy creamer or drink it black. And that's really the best way to drink coffee. But you can go ahead and have your coffee as long as you're drinking it correctly. And same goes for tea. So again, you know, I always say the best beverages are water, coffee, green, black, or white tea, because they have really the most antioxidants. And even topically, these teas have been shown to decrease the duration of radiation burns. And there's a randomized trial that's being conducted now in Germany where they're using green tea extract to see if it reduces the risk of developing colon cancer. It's also, I just wanted to mention here, good for heart disease as well. It improves blood vessel function, which is endothelial function. So I can't talk about breast cancer without including soy, because there's so much confusion and misinformation, unfortunately, about soy. And a lot of oncologists, unfortunately, tell their patients not to have soy because it is a little bit confusing. And so I will try to clarify, you know, some of that confusion, but there's multiple studies looking at over 11,000 patients, and they all conclude the same thing, that soy intake after a breast cancer diagnosis is actually associated with reduced mortality, reduced death, reduced recurrence in estrogen positive, estrogen negative women, as well as pre and postmenopausal patients. It also is associated with a lower risk of uterine cancer. And it's important to distinguish real soy from man-made soy. So man-made soy, which is that soy protein isolate that's found in nutrition bars, I would argue is really not good for anyone. However, real soy or kind of the Japanese type soy like miso, tofu, edamame, tempeh, soy milk is actually the soy that I'm referring to, and that's good soy. And so I will argue that soy is actually good for women with breast cancer. And the reason is this. So soy is confusing because it can bind to two different receptors in the body. You have beta receptors and alpha receptors. So when you ingest soy, it preferentially binds to beta receptors first. And beta receptors are found exactly where you'd want them, in the bones. And so when you ingest soy, it binds to receptors, these beta receptors in the bones, and actually mimics estrogen and strengthens the bones. Whatever is left over then binds to the alpha receptors, which are found in the breast. When it binds to the alpha receptors, it actually blocks estrogen and acts exactly the same way that tamoxifen does. And so it actually acts in the body exactly the way you'd want it to. And so that's why it reduces the risk of breast cancer and actually does strengthen bone density as well. And even more interesting is that for women who have a BRCA mutation, there was this really fascinating study that found that when they added soy to cells that had lost their BRCA gene, it actually could even reactivate the BRCA gene. And so there's even studies going on in this realm as well. And so, you know, it's really shameful, unfortunately, that a lot of women are told not to have soy. I think that the idea is if you haven't been having any soy and the body's not acclimated, you don't want to all of a sudden start having a ton of it, but rather have it in moderation. And I think that is very reasonable. In fact, it's been shown to actually compete with tamoxifen in the breast. And so I think that, you know, considering it works like tamoxifen and we have ample data showing it's safe, I would say that I think soy is perfectly safe and actually helpful if you have a breast cancer diagnosis. So I want to talk a little about flax seeds, and there's a lot of data looking at flax seeds. I'm a huge fan of flax seeds because they have the highest content of lignans of all plant foods, and lignans are anti-carcinogenic. And in the lab, in dish, they've been shown to not only have direct anti-cancer growth against breast cancer cells, but they also can prevent cancer cell migration or development of metastases. And they have a chemical structure that's, again, very similar to tamoxifen. There was a study published from Germany in the Journal of Clinical Oncology in 2011, looking at over 1,000 postmenopausal women with a history of breast cancer, and they measured their serum interlactone levels, which is a marker of lignans. And they found a significant improvement in survival in patients who had higher lignan levels. And this was true especially in the ER negative women, but found in all patients. And there's actually 2 good studies that I want to show you looking at the benefit of flax seeds. So this was actually a double-blind randomized placebo-controlled trial, which is the highest quality study that you can do, where newly diagnosed breast cancer patients were randomized, and half of them were given a flaxseed muffin with 3 tablespoons of ground flaxseed. The other half were given a placebo muffin, and they did not know which one they were getting. And then after only 1 month, they reanalyzed their tumor to look for proliferation markers. And what they found was that there was a significant reduction in what's called the Ki-67 labeling index, which is a marker of proliferation, a 71% reduction in HER2 new expression, which is also a marker of aggression, and a 31% increase in apoptosis or cell death. And the only downside was it actually improved bowel movements. It was evidence that it did not decrease the efficacy of tamoxifen. It was very safe in these patients. And so based on this study, I would argue that having 1 to 3 tablespoons of flax seeds a day is beneficial. They do need to be ground for absorption, and you can buy them ground. It's much easier, and I always recommend refrigerating them for preservation. This was another study done looking at flax seeds, where they took women not with breast cancer, but who had a biopsy showing an increased risk of developing breast cancer due to finding atypical ductal hyperplasia or LCIS. And what they found was that they gave these women 1 tablespoon of ground flaxseed a day for a year, and then they repeated their breast biopsy and basically found the same results as the previous trial. 80% of the women had decreased Ki-67 levels, so decreased proliferation, significantly less atypia in the breast, decreased proliferation, fewer precancerous changes. So I think flaxseed is a great food that we can use for both prevention and for breast cancer survival. So I have to talk about beans because I'm a huge proponent of beans, and I call it the anti-red meat. So, beans include, black beans, cannellini beans, kidney beans, lentils, chickpeas, soybeans, peas. And I like to quote, there's this Food Habits in Later Life study where they prospectively followed 785 people over age 70 for 7 years. And this was done throughout the world in various countries. And they found that only legume or bean intake was associated with an 8% reduction in death for every 20 grams of daily intake. Beans are one of the healthiest foods you could eat. It lowers your risk of cardiovascular disease, stroke, blood sugar, cholesterol, lowers the risk of cancer, improves constipation. And the only caveat, again, is that you want to introduce them slowly into your diet to reduce gas. If necessary, you can take this enzyme found in Beano before eating if you become gassy easily. But I think beans are something that is the one food I would argue that you should try to eat every day. And, one of the reasons is if you look at their nutrient content, they're low in calorie, high in fiber. They're a good source of protein, calcium, iron, potassium. So I am a huge fan of beans. And, I just say one of my pet peeves is when you order a salad in a restaurant and they always ask, what protein do you want to add? Chicken, shrimp, meat. My answer is always beans. So throw on all those beans and that's your perfect source of protein. Okay, so I could talk about food for a very long time. I want to switch gears a little bit and just talk about the heart-breast connection. So, some cancer therapies are associated with cardiotoxicity, as we know, and a plant-based diet, I hope I'll convince you, is not only best for the breast, but good for the heart as well. And good heart health can result in better breast health. And exercise, again, is good for the breast, is good for the heart. Turmeric is one of the healthiest spices that you can add to your diet. Again, good for the heart, good for the breast. And just one slide about turmeric or curcumin. Without boring you, again, there's a very complicated biochemical pathway. And just to show you how many pathways turmeric acts through to cause apoptosis or cell death, it's one of the most potent anti-inflammatory, anti-cancer foods. And again, I'll stress it's better to eat the spice, which looks like this, than take it in a pill. A lot of the supplements are just not regulated and you don't know exactly what you're getting or how much you're getting or the contamination. So, I always recommend just adding spices to your food and kind of leaving them out on your kitchen counter so that you don't forget and just add them to anything. They're good for blood vessel function. They're good for blood pressure. And there's a very interesting relationship between cholesterol and cancer. And so there are some studies, and I just highlighted a few here, that high cholesterol is associated with increased cancer risk, and not just breast, but endometrial, colon, various cancers. There's other studies show that people who take statins or anti-cholesterol drugs have improved survival from breast cancer. Furthermore, patients with triple negative breast cancer actually have a better survival when they have low triglyceride levels. And this is also true for even uterine cancer. This is basically a plot showing that there's an increased risk of uterine cancer with increasing levels of cholesterol. So based on all these studies, there's been some laboratory research trying to investigate why that's the case. And so basically, the most abundant oxidized cholesterol metabolite is called 27-hydroxycholesterol, but we'll call it 27-HC for short. So when that's released into the bloodstream, it's been shown, unfortunately, to stimulate proliferation of breast cancer cells, endometrial or uterine cancer, prostate cancer cells, and it can act right on the estrogen receptor to promote tumor growth. and then it can actually go back to the liver to promote metastases. And so in estrogen positive breast cancers, their 27-HC content is actually increased in the breast. And fortunately, there is an enzyme that the body produces called CYP7B1. You don't have to remember that. But this enzyme can break down this cholesterol metabolite. And it's found in various concentrations in different people. And we found that patients who have low levels of this enzyme actually have decreased survival from breast cancer, perhaps because their cholesterol level is too high. And it's hypothesized that some estrogen-driven breast cancers may rely on cholesterol to grow when they no longer have any estrogen. And this may explain resistance to drugs like tamoxifen or Arimidex. So some of the hypotheses are that vitamin D may decrease cholesterol levels in the blood, and this may explain why high vitamin D is linked to better cancer survival, and why statins, which lower LDL cholesterol, are associated with better survival. And we know that whole food plant-based diet alone will also lower cholesterol. So I think it's really important that we really make efforts to reduce cholesterol with a combination of diet, lifestyle, and using medication like statins when appropriate. So I'm going to talk a little bit about hot flashes, because as you know, a lot of the medications that you're put on, as well as just going through menopause, can cause hot flashes, and it's not safe to use estrogen. And there's medications that are prescribed like Effexor. I'm a strong proponent of exercise for hot flashes. There's some data that shows that vitamins B6 and E can be helpful. But one of the things that I like to use most often is actually this Swedish pollen extract. It goes under a few different names called Relizin or Femal. It's not a prescription. It's actually available online. There was a randomized placebo-controlled study that was done, which compared this pollen to a placebo in women with breast cancer, and found that this extract significantly reduced hot flashes. It was perfectly safe. It did not have any estrogenic activity. And it was important to note that it took several months to take effect. So with each month that women took this, the hot flashes continued to diminish in intensity. So it really took about 3 months to notice a significant improvement. They also measured blood work in these women, and there was no change in their blood work at all, their hormone levels. So it's considered to be very safe. Alternatively, as I mentioned, there are some vitamin regimens. So one that I've used is vitamin E, 400 milligrams a day. And again, there was a nice placebo double-blind trial that showed a significant decrease in hot flashes in women who took vitamin E. This can be also combined with B6. I didn't write the dose, but it's 200 milligrams a day. And based on nutritional studies, which have shown diets high in vitamin B6 can be associated with improvement in hot flashes. There's actually a trial now going on at Thomas Jefferson University, where they're enrolling patients actually with prostate cancer who can also suffer from hot flashes due to the medications that they take, looking at to see whether vitamin B6 supplements can improve hot flashes. And that's something I've used in a lot of my patients with breast cancer as well. There's also some homeopathic regimens that are available. One's this Astiine. Acupuncture has mixed results, but there's certainly no harm in trying. And there have been studies even looking at sham acupuncture. Again, in the worst case, it provides relaxation, which is never a bad thing. How about vaginal dryness? Again, so as women proceed through therapy, vaginal dryness is often a problem, and stenosis or narrowing of the vagina. And as you know, it's really not safe to use estrogen. So we can use dilators and then natural lubricants. And the one that I have found is most helpful and actually has been studied is this hyaluronic acid. It's a suppository. It's 5 grams used every 3 days for a month. And that was shown in a clinical trial to significantly reduce vaginal dryness. And again, is very safe. It's not estrogen based. And just some fun fact is that there was actually a study showing that women who had an apple a day had better sexual function, but it was important to keep the skin on. So the benefit is probably in the skin. Okay, so exercise. I'm a very big proponent of exercise for multiple reasons. So and I put these little photos here just to remind you that exercise comes in all forms, and it's important to follow whichever one you like and will stick with, and to kind of change it up a little bit. But doesn't have to be super intense exercise, but it's important to incorporate weights, which are really good for bone density. I always like this picture of nature. During the pandemic, I started taking hikes, and just being outside in nature is really good for mental health, physical health. Doing yoga, Tai Chi, anything that you will stick with and enjoy. And the reason is there's a meta-analysis showing significantly increased risk of uterine and breast cancer in sedentary women. Exercise improves immune function. It improves insulin resistance, so it's really good for diabetics. It also can improve joint pains that women develop on these medications. It's good for hot flashes. It improves fatigue, and it decreases estrogen. So a lot of women ask how much. No one knows exactly, but it's recommended to get at least 150 minutes of moderate exercise weekly. And it's important, like I said, to incorporate strength training, maybe twice a week. It doesn't have to be super heavy, but even 5 pounds is really good for bone strength. And there's studies supporting this. So there was this randomized trial that was performed and published in the Journal of Cancer in 2019 that enrolled over 1,500 women with a history of breast cancer who were taking an aromatase inhibitor, which are drugs like arimidex, letrozole, and who were experiencing arthralgias or joint pains. And they randomized them to an exercise program where the women were actually met with a trainer twice a week. They did incorporate, as I said, twice weekly strength training, as well as aerobic exercise. And the control group were given no instructions specifically. And they found that there was a significant improvement in not only arthralgias or joint pains, but hot flashes and fatigue as well in the women who were randomized to the exercise arm. Some other factors that we don't talk about a lot, but I feel are really important, are sleep, stress, and anxiety. And those are the ones I think that are often hardest to manage. But there are things we can do. So I'm a big advocate of massage therapy, Reiki therapy, support groups if they're appropriate for you. I mentioned exercise, music. CBD oil can be effective for joint pains, as well as even the prescription medical cannabis. So I do prescribe medical cannabis, and it is quite helpful actually, not only for sleep and anxiety, but also for women who have pain. It's good for nausea, even for chemotherapy-induced neuropathy. And so that's something that can certainly improve quality of life. The idea is that the THC is balanced with CBD so that you're not getting high, but really taking advantage of its medicinal properties. And also, I can't stress enough the importance of mindfulness, meditation. And so I always say these are the kind of the 4 pillars that you can use to empower yourself, which are nutrition and eating a plant-based diet, incorporating exercise into your life, following good sleep habits, and reducing stress. And so I just wanted to say that I don't want the takeaway to be that you have to be a vegan. I am not a vegan. I do try to eat plant-based as much as possible. And I certainly just try to choose the healthiest option if I'm out, I don't have the opportunity to be plant-based. But I just like to show this because the idea of being eating whole food plant-based is that the foundation of your diet should be fruits, vegetables, beans, whole grains, fiber-rich diet, and really trying to just limit, you don't have to eliminate, the meat and poultry, seafood, eggs, oils, highly processed foods, just eating real foods. And the more you can do, the better. And so these are kind of my top 10 foods, just as a reminder to kind of eat colorful, eat the rainbow, the cruciferous vegetables, nuts and seeds, greens, including beets, kale, spinach. I mentioned beans, which I, again, try to eat every day. For fruit, berries are probably the healthiest, but you don't have to worry about eating fruit, even for diabetics, because the fruit is coupled with fiber. It will not spike your blood sugar like eating table sugar. Adding spices to the diet. So rather than salt, just throw in, and there's no unhealthy spice. So you can throw in turmeric, rosemary, oregano, just to name a few. I didn't mention, just for time's sake, mushrooms, which are super healthy, very potent against cancer. And mushrooms are one of the few foods that are much healthier cooked. So you do want to have mushrooms cooked. Garlic and onions are also super healthy, and those actually are healthier raw. And then just a reminder, the whole grains. There's so many great whole grains I've discovered. Oats, barley, quinoa, freekeh, sweet potatoes. And then for beverages, as I said, water, coffee, white, green, black tea are really the healthiest beverages. And so I like to stress, the blue zones, which are the few communities throughout the world, which have the longest living people on earth. And what do they have in common? They focus on family, they don't smoke, they're socially engaged, they're active, and they eat beans every day, and they eat plant-based. And so I hope I've identified that there's a lot of toxicities, but there's so many different things that you can do yourself to help remedy these. And, a lot of patients ask how to further their knowledge. These are the books that, if you notice, they're all written actually by physicians. They're all evidence-based, looks at nutrition. These are some documentaries. I think they're both available on Netflix, which I really like. And I'm happy to say that I've created, with the help of my daughter, an app that's available in the Apple iOS store, giving this information. It's free. This is what it looks like, called Mind Over Matter, which you can download. And I'm continually updating it with all new relevant studies that are published. So I'm very happy to answer any questions at this point. Thank you so much.
Thank you so much, Dr. Zinkin. That was an outstanding presentation and incredibly informative.
Thank you.
I know we just have a few moments, but someone did put in the chat, do chia seeds have the same benefits as flax seeds?
Great question. So just for time's sake, I didn't have time to mention. So I'm a huge fan of chia seeds. Again, they need to be ground for absorption. They don't have the same specific breast cancer benefits. However, they are super healthy. So I can tell you, I always have ground flax seeds, ground chia seeds, and hemp hearts in my refrigerator, and I throw them into my food every day. But I wouldn't only have chia seeds. I would definitely add flax seeds as well.
Thank you so much. There's
Sure.
also a question, how is hyaluronic acid administered? So
it actually comes as a vaginal suppository, and you put it in yourself, almost like a tampon. But it's not, it has a bad name. It's not an acid. It does not burn or hurt.
Excellent. And a question about Reiki. Do you refer your patients to Reiki therapy? I know that that's something that comes up quite a bit.
Yes, so I do recommend Reiki therapy. There's a few actually retired nurses in the area I know who are Reiki masters, and I've gotten very positive feedback. There is good data showing that it improves outcomes and quality of life in breast cancer. So yes, the answer is I do refer.
Great. And another question, is fish considered as poor of a choice as meat in a diet?
Excellent question. So everything's relative, right? So I say, if you're going to choose between salmon and steak, I would obviously choose the salmon. If you're asking me to choose between salmon and, a bean burger, I would choose the bean burger. So I think, fish is certainly a healthier choice. It's all, what are the options and what are you comparing it to? So I think in the kind of meat world, yes, fish is considered meat, but I think that's the healthiest choice of the meats.
Thank you. And just one of the final questions, can you give an example of a micronutrient?
Oh, sure. So the micronutrients are these like antioxidants and chemicals that are found in foods that they're not. So a macronutrient is something that's like a carbohydrate, protein. A micronutrient is something, like a calcium, iron, and antioxidants, things that are, not really as discussed as those macronutrients. And part of the problem I have is, I think it's really helpful to meet with a nutritionist, but a lot of their training is in macronutrients rather than micronutrients. And so there's certain things that you just can't measure, like these polyphenols and things like that that are found in coffee and certain foods. They're really difficult to measure.
Thank you. And there was a question on the chat about this presentation, and this was recorded, this program, so it will be available at a later time on our Facebook page or YouTube channel and on our website. And I cannot thank you enough for your time today, Dr. Zinkin. This was fantastic. Thank you so much for being here today and sharing your wealth of information with us.
And thank you so much for the invite.
Oh, it's our pleasure. And for all those who attended, please be on the lookout in your inboxes. On Monday, you will receive an evaluation. That does help us to plan future programs. So thank you so much again for attending. And as always, please feel free to reach out to all of us here, all of the community partners here, Adelphi Breast Cancer Program, Sisters United in Health, Northwell Health, and the Cancer Services Program. Be well, everyone. Stay safe and have a wonderful weekend. Thank you.
Thank you all for attending.
Take care.